Hey everyone, so you just had your knee replaced. Well, congratulations. Yes, often at times in my practice, I see patients who've kind of missed the window of getting their knees replaced. They waited too long and they can't find a surgeon that's willing to replace their knee. And this really leaves someone with a really low quality of life for their later years. So nice job being courageous and getting in there and getting your knee replaced. The first big step to a better quality of life. Now, there are some very important tricks of the trade and techniques, as well as exercises that will really help to ensure your rehabilitative recovery goes smoothly. That's what this week's video is all about. I hope you find it really helpful, and be sure to hit the subscribe button. So the first and most basic thing to discuss about total knee recovery is the value of icing. Yes, after following a total knee replacement, your knee is going to be quite inflamed, aggravated, and painful. And icing is something, the first line of defense, to decrease some of this inflammation and to speed up your healing process. Yes, the better we can stay on top of the inflammation, the less pain and the faster recovery you may experience. So icing regularly. You can ice if it's quite painful on the hour for 20 minutes, but if it's not, if pain's pretty minimal to moderate, at least twice a day is what I'd be shooting for 20-minute durations. Now, it's important to have a little bit of barrier between the ice and your skin. And if it's a moist towel or something that you're using, that can be a better conductor of the cold to more effectively cool the area and reduce inflammation. Other than that, it's really, really important to try to get the knee straight. Yes, a full knee extension. Now that's critically important, and although it's easy to rest with some support under the knee, it's really important to actually rest periodically throughout the day with some support under the ankle. It's going to be more comfortable to rest your knee with some support under the knee itself. That's because with 20 to 30 degrees of knee flexion like this, that's considered the open pack position of your knee with the least bone on bone, and it's usually the most comfortable position. But if we leave our knee like this, it's going to be stuck in that position. You're not going to be able to get it straight. So that one of the most important things, again, is to rest with your leg fully extended. Now, unfortunately, this is going to be painful on the knee, but to restore a normal walking pattern, this is number one. So getting the knee straight is really important. Now, when you're sitting, if you're resting throughout the day and say watching television, I would put the foot up every hour for as long as you can tolerate, maybe 5 minutes. I'd say 10 minutes is the most you need to do at any one time. But in the beginning, it may be much more limited to that due to pain, like 30 seconds to a minute. So again, working your way up to about a 10-minute duration of straightening your leg frequently throughout the day, at least every hour or two. The third key aspect of total knee replacement recovery is to work on restoring a normal walking pattern or gait pattern. What I mean by this is to use your walker and overemphasize a smooth gait pattern, getting your knee high up, a heel to toe transition, equal step length, and trying to progressively improve your duration of walking. Now, I would base it on time versus distance, because one day, and as you recover, you may be moving a little bit faster than on a previous day. So the distance is less relevant than the duration. So I'd set a small timer, maybe a stopwatch, something like that, and keep an eye on that, and progress is tolerated. Meaning that if you're able to walk and pain's not past a 5 out of 10, pain's not lingering more than about a minute or two when you stop the exercise or stop the walking process, that's an okay type of pain, and to try to up that by about a minute or two per walking session. So 5 minutes to 6 minutes to 7 minutes, not jumping from 5 minutes to say 20 minutes, something like that, which will most likely result in a flare-up. So as far as the initial exercises for a total knee replacement recovery, you should have been taught these in the hospital. So the purpose of this explanation is to serve just as a reminder and like a visual cue to remember how to do these exercises correctly. The first and foremost and most important is called a heel slide. When you do a heel slide, you want to just lay down on a firm, flat surface In the beginning, if it's more comfortable for you and if it works for you, if your bed's pretty firm, that will work. That's what I'm going to be using today, the fairly firm bed. Beyond from that, you can use a pillow if you like. And you're going to want to have, maybe not initially at first, but eventually a strap to use. And I'll explain why. So first you want to lay down. And a heel slide is just like this, just down and back. Okay, now of course there will be some pain with this, most likely. And what I'd recommend is to just stop right when that pain comes on, not to slam right through all of that pain, but just to come on the pain a bit and then off. Sometimes referred to as kissing the pain. On and off. Okay, we're just working on your range of motion. Now notice how my other side is bent. That's to keep my low back in a better position, and I highly recommend that. So opposite side, bent, and then sliding back and forth. Once you've been working on this for a while, and it's going along smoothly and pain has reduced, it'd be best to start using a strap. So when using a strap, you just want to place it around the ball of the foot. And really what we're doing is when we're coming back up, we're just giving yourself a little bit of a pull. Again, light to moderate only, never moderate to too intense. Just to bring on. I hold it for about 5-10 seconds. And then you can start to gently push against the source that you're using, to whatever strap you're using. So coming back up, assisting with the strap a little bit, holding for that 5-10 seconds, and then again moving back out of that position. So that's a heel slide. Again, I would just start with it with no strap needed, just down and back. This is the primary way where we're going to get more bend or more knee flexion in your knee, like I was discussing earlier. Second exercise is what's referred to as a quad set. Now to do a quad set, again, I'd keep the opposite leg bent. And what we're trying to do is push the knee, back of the knee, into the bed or into whatever surface you're working from, and tightening the thigh, what's called the quadricep. Why is this important? Is that following any kind of surgery, there's normally a corresponding area that is somewhat traumatized. And with total knee recovery, the quadricep, this thigh muscle, can become difficult to get that to what's called fire again, or contract the way it needs to. So that's part of why you're doing this one, is to get it so that that muscle can fire or come on like it did before your knee surgery, and really before you had serious knee pain as an issue. So we're trying to contract it and keep it tight for 5 seconds, 5 sets. Everything else today will be really repetition based, so between 10 and 20 reps, 2 run-throughs, twice a day. But I would recommend doing this one a little bit different. So it's the quad set is 5 sets of 5-second holds. Okay, next exercise is referred to as a hip abduction. So just kicking to the side. Now the muscle that we use for this exercise, called the glute medius, is one of the most important exercises in muscle groups for the knee, because the glute medius is what stabilizes and really helps to prevent knee pain. So with my patients, I normally start here and then progress into a seated version, and then even a standard version, and then a standard resisted version of hip abduction, or really glute medius strengthening. So just moving to the side and moving back. Moving to the side and moving back. Now, if that amount of friction with either the heel slide or the hip abduction the amount of the friction generated from your leg rubbing against the surface you're working from is too great and it's too painful, I would actually recommend taking a plastic shopping bag and putting it around the foot so that you have an easier ability to glide, both with the heel slide and with the side kick. That technique works really well. The next exercise is to work on what's called a bridge. Now, a bridge is a bit higher level than the things that we've been talking about so far. So if that is pain more than a 5, I don't want you to do it quite yet. But if there's pain less than a 5, it's one of the best ways we can strengthen a large number of muscle groups that will help you with your recovery. So the next exercise is also pretty high level. So if there's pain more than a 5, I don't want you to do it yet, but it's referred to as a straight leg raise. Now we don't need to come way up here, just to about equal with the opposite leg. And the real key is to come down slowly. That's where the majority of strength is built. So raising up and coming down. Why that relates with total knee recovery is that we need the quadricep to be quite strong to stabilize the knee in full extension to maintain that position throughout this exercise. So it's another great way to get the quadricep as strong as we need to get back to the life we want to live. So this video has been all about what to do following a total knee replacement surgery. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve quality of life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life.